Right. Hi, everyone. Thanks for joining us this afternoon for office hours. We're going to be talking about different conditions that affect gut health. A lot of you have probably heard about leaky gut, dysbiosis, maybe SIBO. And if you're having digestive issues and you haven't been able to solve them, you're probably wondering which one of these you might have. So this afternoon, we're going to go over these conditions and hopefully give you guys some guidance to figure out your next steps in terms of solving your digestive problems. My name is Jenny Askew, and I'm here today with Katherine and Erica, and we are the Nutrition Clinic for Digestive Health. And I hope this can be an interactive presentation. And if you guys have questions, I'd love to address them during the presentation. So don't be afraid to pop them in the chat, and we will be watching that and hopefully have some time for Q&A at the end. A little bit about our practice. We specialize in nutrition for digestive issues. We are dietitians with additional training in functional medicine, specifically in digestive health. So we do really deep dives into digestive issues and help people get the answers that they need to feel better and to finally solve their digestive problems. Our typical client has been suffering from digestive issues for typically years, 10, 15, 20 more or more years of suffering. And we are the place that they come to finally get the answers that they need to feel better. So if you've ever been told that your labs are normal, everything's fine, digestive problems are normal, it's all in your head, try yoga, try mindfulness, try this medication, just take Miralax every day and eat more fiber, or to try another probiotic or a different probiotic and it hasn't worked, or it's made things worse, you're definitely in the right place. So this is how our typical client usually comes in, just super frustrated over it. They've heard all the things, tried all the things, and they're not getting the answers that they need to feel better. So in terms of digestive problems, specifically what we're working with, a lot of times GERD or acid reflux, constipation, diarrhea, IBS, IBD, so, Crohn's and colitis, bloating, gas, and SIBO are things that we see a lot and work with all the time. And our typical client has sometimes not had a normal bowel movement in so long that they don't even know what that is. And what I think is more frustrating is that they've been dealing with digestive issues, usually like, 10, 15 years, sometimes more, and no one's ever bothered to ask about their bowel habits. So a goal bowel movement would be a type 3 or a type 4 on this scale. This is called the Bristol stool chart. And yes, it's actually a thing. And it assesses the quality of stool. So a type 1 and type 2 would be more constipated. If we get to the other end of the chart and we're having a 6 or a 7 or even a 5, that's trending more towards diarrhea. 7 is actually diarrhea, and 1 is a very true constipation. Sometimes constipation is defined by frequency in terms of how often you're having a bowel movement. We should be pooping 1 to 3 times a day, you guys. If we're not, we're backed up. Consistency can indicate constipation, but certainly frequency can also. So very important that we're having 1 to 3 normal bowel movements a day. On this chart, that's going to be your type 3 or type 4. And we are really strong believers in the body can heal itself, but first you have to give it what it needs. And our world kind of revolves around decreasing inflammation, balancing the microbiome, which we're going to be talking about a lot today, and also repleting nutrient deficiencies, because healing the body from digestive issues, especially chronic ones, is going to require a lot of energy and a lot of nutrients. So, the actual causes of digestive problems and what we really figure out for people when we get to a root cause approach is that they're all stemming from some combination, and it's never just everyone's looking for the thing, like what's causing my digestive issues? Why am I having diarrhea? Why am I having constipation? But it's never just one thing. It's a combination of things. So it can be a combination of any of these things, but we've got food sensitivities, diet, stress, medications, imbalanced bacteria, which we're going to be talking about a lot today, parasites, not having proper digestive support. So some people don't have enough stomach acid, which means they're not signaling enzyme production, so they're not breaking down their food, and that can actually perpetuate overgrowth. There is so much here and so much to unpack, but also nutrient deficiencies really contribute to digestive problems too. Just a quick, simple one off the top of my head, magnesium deficiencies can actually cause constipation. I mean, there is so much here, you guys, so much to unpack, so much to look at. But if you can really assess these things, which we do, and we do it really well, you can really solve your digestive problems. So I'm going to start with leaky gut. We're talking about leaky gut, dysbiosis, and SIBO today. And with all of these, we're going to be looking at the condition, what the symptoms are, and what the solutions are for each. And this is a quick overview of these conditions so that you know where to look next. It's probably not enough time to get into all the things, but we've got a really cool offer for you at the end if you want to start digging in more to your digestive problems. So stay around for that. But leaky gut, what it is, it's a permeability of the intestinal barrier. And it's caused by lots of things. So again, it's never just one thing, but diet can certainly contribute to leaky gut, especially the standard American diet. Gluten, dairy, excessive sugar, processed carbohydrates. Gluten actually has a compound in it that increases the production of something that causes the intestinal barrier to leak. So it increases zonulin production, and zonulin actually holds these junctions open in the small intestine and contributes to leaky gut. So there's lots of reasons someone might want to avoid gluten or dairy or wheat or sugar, but like we know for sure that there is a specific mechanism behind gluten that contributes to leaky gut. So that's really significant. If you're on the fence about taking gluten out of your diet, you might just want to try it for, I would say, at least a month and see how you feel, because that's just something that we know contributes. But so does ongoing stress, right? It's not ever just one thing. Antibiotic history and other medications certainly contribute to leaky gut. Toxic exposure, which unfortunately today we're bombarded with toxins. So we certainly want to address that and look at that, see if there's anything significant, see if you're detoxing well. Ignoring symptoms and hoping they go away can also contribute to leaky gut, because things are just going to get worse if you're not addressing the issue. And then, of course, infections. H. pylori is a common one in the gut that can contribute to leaky gut. So in order to feel our best and decrease inflammation, we need the gut to be selective about what passes through the intestinal barrier. And if it's not, we're going to end up with symptoms. So typical symptoms of leaky gut are going to be systemic inflammation. So it's really like whenever someone has multiple conditions going on and you can't figure out what's causing them. So like headaches and fatigue, rashes, digestive issues, autoimmune diseases certainly too. It's kind of like there's a lot of random symptoms and no one can put the pieces together. I personally, doing what I do, would go straight to leaky gut and look at cleaning up the diet to see if we can get some relief. So there's a few ways you can test for leaky gut. The gold standard is a blood test looking at zonulin levels. In our practice, we really don't test for it. We more focus if we see someone who is kind of presenting with lots of different health issues, our focus and recommendation is going to be to go to food sensitivity testing and probably celiac testing. We have a wonderful test. I'll show you a sample of that in just a minute, that identifies foods that are causing inflammation. It's highly accurate, and we take a really unique approach to this in that we are looking at your test results and helping you focus on what you can eat to decrease inflammation in your body. And when that happens, instead of constantly putting out fires caused by inflammation, your body can divert all of its resources to healing. And when it's healing, the gut has time to recover and recoup, and people usually feel better in a couple of weeks. We are seeing a 50% improvement with this food sensitivity test that we know and love in our practice. So my recommendation would probably be to get some really specific information on what's causing inflammation in your body, decrease that inflammation, let the gut heal. Make sure you don't have celiac. A lot of times this is improperly tested for and I think very underdiagnosed. We want to rule out celiac and non-celiac gluten sensitivity, again, to decrease inflammation so that your body can drive all of its energy and resources to healing and gut repair. Um, Testing is best in my opinion, but if you wanted something to start trying at home today, you could try taking gluten out of your diet, but we only recommend doing that after you've been tested for celiac disease. Otherwise, you could miss an important diagnosis of celiac. Taking out sugar and taking out dairy, if you have a sensitivity to these and it's causing inflammation, you don't just want to go like low gluten or low sugar or low dairy. I would say none, like literally zero in your diet, because even a little bit, if it's a sensitivity, is going to cause a problem. You can always reintroduce things in a few months if you're getting resolution and see how you do with them. But the best thing for any sort of elimination diet strategy is to completely remove the food, like completely 100% remove it, and then add it back after your symptoms have gone away. If you're still feeling bad, adding back the food isn't going to tell you anything because your symptoms haven't resolved. So you're never going to have that really clean experiment approach with a clear cause and effect. Let's see. Oops, hold on. Oh, yeah. And this is the example of the food sensitivity test that we know and love. It's the MRT test. It has several different panels. It's actually 2 pages, and they test, we're at 176 foods and chemicals. They're testing foods in every food group, and they're testing chemicals. Some of the chemicals are naturally occurring in food. So if you know, for example, that you are reactive to capsaicin, which is found in spicy foods, you would know in addition to what's coming back on this panel that you also need to avoid spicy foods for a while. So this is the best way, in my opinion, to heal a leaky gut. There's additional testing depending on how someone presents and when their symptoms started that I might recommend. But this would be a great first step if you are someone who has an autoimmune disease, systemic inflammation, a lot of random symptoms that no one can put together. I would definitely start here. And I mean, what we're seeing with this test is a 50% improvement in just 2 weeks, which is amazing. All right, and next up is dysbiosis, and Katherine's going to talk to us a little bit about that.
Yeah, thanks, Jenny. So dysbiosis is really an imbalance of your good and bad bacteria or yeast, like candida, you might have heard before, which results in toxic byproducts. Sometimes parasite symptoms can mimic dysbiosis. A lot of the common causes we see are antibiotic use, food poisoning, low stomach acid, lack of diversity in the diet, motility issues in the gut, and trauma. Some of these common symptoms are going to be bloating, constipation, and diarrhea. And we really, as Jenny was saying, testing is preferred. And especially, for this situation, we want to know like what is going on behind this dysbiosis? What are these patterns in the bacteria of good and bad bacteria? Are you properly digesting fat, protein, carbs? And we can see all of that through testing that I'm going to show you in a second. And also just making sure that it is in fact dysbiosis that is your issue and we're not missing something that could be, presenting overlapping symptoms. So these are some of the tests that we would recommend. The first one here is a stool test, GI comprehensive stool test. It's going to look for that pattern in bacteria, good and bad, show us that digestion patterns, and then the SIBO breath test as well. So these are two tests that we use all the time, and these would be our first step for someone with these symptoms. Now, for diet strategies, definitely increasing the diversity in your diet, which is going to help to, balance out all of that bacteria. Digestive support is commonly needed, especially if someone is, not breaking down the foods properly or even absorbing them properly. Some people do better digesting cooked veggies instead of raw. And then if you were going to try something at home, doing something like a low FODMAP or paleo approach could work. But, a lot of these diets are really unique, and, the way they're implemented per person is different. So it can be nice to have support in that area too.
Okay, I'm going to jump in and talk a little bit more about SIBO, small intestinal bacterial overgrowth. And this is a subset of dysbiosis, but a lot of our patients come in with SIBO, reoccurring SIBO. This is something that potentially a GI doctor would order or has ordered at some point. I'll get in. Yeah, okay. I don't want to jump too far ahead. So there's different types of SIBO: hydrogen, methane, and hydrogen sulfide SIBO. Testing really shows us how significant the SIBO is, where it's presenting within the intestinal tract, and the type of SIBO, so that we're able to actually focus and kill off, get rid of that excess bacteria. Some of the very hallmark symptoms are bloating. You might wake up bloated. You might drink some water and get bloated. But bloating throughout the day and it getting worse throughout the day is pretty common. A lot of people will have some symptom relief with following more of that low FODMAP diet, but not everybody. And if you've researched or tried the low FODMAP diet on your own, there are nuances to it, and some people react to certain FODMAP foods and not others. So that's where we can come in and help navigate that as well. And then some of the aftermath, because of this bloating you get from these hydrogen and methane bacteria, some people will get more on that constipation side, some people will get more on the diarrhea side, and some will go back and forth between the two. And it's often this feeling of trapped gas. They feel very full after eating. Sometimes reflux ends up showing up, sometimes white coating on the tongue. There are a lot of different ways it shows, but that bloating is really a hallmark sign. And we always go back to the root. So, especially with those reoccurring SIBO patients, we need to know who or what is causing those issues. So we can often trace it back to some different things. Low stomach acid is a really common one. When we have low stomach acid, we're not breaking down our foods properly. These are often people that have been on PPIs, proton pump inhibitors for a long time, multiple rounds of antibiotics, on a lot of pain medications. All of those things can cause SIBO. Motility issues. So for people that have more on the hypothyroid side, that's one of the things that can cause that slowed motility. Stress can cause slowed motility. We look at how often you eat, the types of foods you eat. And then some other conditions are always red flags for us: endometriosis or reoccurring fibroids. And then Ehlers-Danlos, if you've never heard of that, and it's often underdiagnosed, but it's hypermobility. So like if you're really flexible, even though you're not stretching a whole lot, this could be a sign, and you're much more likely to have SIBO. So I do want to show what the test looks like on this next slide here. So you can kind of see it's really nuanced. It looks kind of straightforward, but there is a lot to digest with this. So it matters where things rise, where the levels rise, and the combination of the two. We can also tell a typical hydrogen sulfide by a certain pattern on this test as well, even though we don't test that. And I will say, the typical of what we would get is maybe even your doctor would do a test like this. And we actually asked to see everybody's SIBO test if their GI doctor did administer it, because oftentimes we have found discrepancies and we've found positives that the patient was told it's negative. So we definitely like to get eyes on any sort of past testing you have had. But often you'll get put on a round of antibiotics and be left in, okay, if symptoms resolve, great. We see a lot of people that have improved symptoms, but there are a lot of nuances to this. Are you using a biofilm buster to make sure it's completely gone? Do you stay on low FODMAP? Do you go off of low FODMAP? What are you doing for probiotics? How do you replenish afterwards? So there is also a big piece of maintenance that we're looking at as well. But this is what a SIBO breath test looks like. So if you haven't gotten the message from our session today so far, testing is really important because so many different symptoms can really be, the root cause could be candida overgrowth, bacterial overgrowth, just not being able to break down and digest your foods well, motility issues. And when we try, we can help definitely decipher one piece at a time, kind of like Jenny had said earlier, try gluten, dairy-free, low, no sugar, and see if it helps. But when we do the MRT food sensitivity, when we do the stool test, we know exactly what's going on and we can speed up your healing process. And I don't know about you guys. I think I know the answer, but a lot of people have tried probably 50 different supplements. They have this whole cabinet of supplements and they aren't working, or they don't know if they're working. So we will really help pinpoint and help you navigate which supplements would be best as well.
Yeah, awesome. Thanks, Erica. Yeah, you definitely don't want to make anything worse either by like treating the wrong thing. So even if you're convinced you have whatever condition, just confirming with testing is definitely the safest thing to do. We've seen a lot of things get worse with incorrect assumptions. Okay, well, I think that about wraps it up. Thank you so much for spending some time with us this afternoon.
Thank you. Have a good week.
Absolutely. Bye.